Welcome to NCLEX Made Easy 91. In today's session, we're diving into 50 high-yield delegation NCLEX questions, RN versus LPN versus UAP. These questions are designed to sharpen your clinical judgment, boost your confidence, and help you master one of the most tested concepts on the NCLEX, safe and appropriate delegation. Follow closely, take notes, and make sure you understand the rationale and strategy behind every correct answer. Let's get started and make NCLEX success easy for you. Question 1. A postoperative client is 6 hours post-abdominal surgery. Which task can the RN safely delegate to the UAP? A. Monitor urine output trends. B. Perform the first ambulation. C. Obtain vital signs. D. Assess incision site. Correct answer, C. Obtain vital signs. Rationale: UAPs can collect routine, stable data such as vital signs but cannot assess or interpret findings. Strategy: delegate stable, routine tasks to UAP. Question 2. Which task is appropriate to delegate to the LPN? A. Develop a plan of care. B. Perform sterile wound dressing change. C. Adjust 4 PCA settings. D. Complete discharge teaching. Correct answer, B. Perform sterile wound dressing change. Rationale: LPNs can perform sterile procedures and reinforce teaching but cannot create plans or manage for titrations. Strategy: LPNs handle stable clients with predictable outcomes. Question 3. Which task can the RN assign to the UAP for a stable older adult? A. Teach use of incentive spirometer. B. Measure intake and output. C. Assess lung sounds. D. Evaluate pain level. Correct answer, B. Measure intake and output. Rationale: INO measurement is a routine task appropriate for UAP. Strategy: UAP equals non-assessment, non-teaching tasks. Question 4. An LPN asks to hang a bag of 4 antibiotics. Which response by the RN is appropriate? A. You may hang this medication. B. You may hang it if it's the second dose. C. You cannot hang 4 antibiotics. D. Hang it only after a UAP checks the label. Correct answer, C. You cannot hang 4 antibiotics. Rationale: LPNs cannot administer 4 push or 4 piggyback medications in most settings. Strategy: for medications equals RN only unless policies allow otherwise. Question 5. Which task should the RN delegate to the UAP caring for a patient in traction? A. Assess neurovascular status. B. Provide back care. C. Adjust traction weights. D. Teach skin care. Correct answer, B. Provide back care. Rationale: hygiene tasks can be completed by UAP, assessment and altering traction require RN. Strategy: delegate comfort/basic care to UAP. Question 6. Which client is appropriate for the LPN? A. New diagnosis of heart failure needing teaching. B. Unstable vital signs post-surgery. C. Stable COPD patient needing inhaler reinforcement. D. Client receiving titrated vasoactive drips. Correct answer, C. Stable COPD patient needing inhaler reinforcement. Rationale: LPNs may reinforce previously taught material and care for stable clients. Strategy: LPN equals stable plus predictable. Question 7. Which task can an RN delegate to the UAP for a stroke patient? A. Perform swallowing evaluation. B. Feed patient during first meal. C. Assist with bed bath. D. Teach aspiration precautions. Correct answer, C. Assist with bed bath. Rationale: bathing is within the UAP role, assessment/TLAs are RN tasks. Strategy: UAP equals ADLs. Question 8. The RN is delegating tasks on a busy unit. Which task is appropriate for the LPN? A. Perform initial assessment. B. Start blood transfusion. C. Administer subcutaneous heparin. D. Interpret lab results. Correct answer, C. Administer subcutaneous heparin. Rationale: LPNs can administer many non-4 medications, including injections. Strategy: LPN equals medication administration except for pushes/blood products. Question 9. Which action should be assigned to the UAP? A. Check capillary refill. B. Apply elastic stockings. C. Evaluate pain relief after medication. D. Teach fall precautions. Correct answer: B. Apply elastic stockings. Rationale: applying compression stockings is a routine, non-assessment task. Strategy: UAP equals non-assessment, non-evaluation. Question 10. Which patient is best for an LPN assignment? A. New onset confusion. B. Chest pain awaiting ECG. C. Stable diabetic needing insulin. D. Post-op with hypotension. Correct answer: C. Stable diabetic needing insulin. Rationale: LPNs can give routine insulin to stable clients. Strategy: avoid giving LPN new, unstable, or complex. Question 11. Which task should be delegated to UAP caring for a client in restraints? A. Assess skin integrity. B. Document circulation checks. C. Offer toileting every 2 hours. D. Determine need for continued restraint. Correct answer: C. Offer toileting every 2 hours. Rationale: routine comfort and safety measures belong to UAP. Strategy: assessments always equals RN. Question 12. Which action can the RN assign to the LPN caring for a client with a PEG tube? A. Insert a new PEG tube. B. Evaluate tolerance to feeding. C. Administer prescribed tube feeding. D. Develop PEG care teaching. Correct answer: C. Administer prescribed tube feeding. Rationale: LPNs can administer enteral feedings but cannot evaluate or teach. Strategy: LPN equals implementation not evaluation. Question 13. Which is appropriate to delegate to UAP? A. Reposition patient every 2 hours. B. Assess pressure ulcer. C. Teach pressure injury prevention. D. Apply medicated dressing. Correct answer: A. Reposition patient every 2 hours. Rationale: UAPs handle routine positioning. Strategy: routine mobility equals UAP. Question 14. Which patient is appropriate for the LPN during assignments? A. New diagnosis of DKA. B. Acute stroke with unstable vitals. C. 10-day post-op stable client. D. Client requiring complex discharge teaching. Correct answer: C. 10-day post-op stable client. Rationale: LPN can manage stable conditions with predictable patterns. Strategy: LPN equals chronic/stable. Question 15. Which task can the RN delegate to UAP during code response? A. Perform chest compressions. B. Interpret cardiac rhythm. C. Administer epinephrine. D. Evaluate CPR effectiveness. Correct answer: A. Perform chest compressions. Rationale: UAP may provide CPR but cannot perform assessment/meds. Strategy: UAP equals basic emergency support. Question 16. Which task is suitable for delegation to an LPN caring for a post-op patient? A. Assess drainage from chest tube. B. Flush chest tube. C. Reinforce dressing on chest tube site. D. Adjust suction on chest drainage system. Correct answer: C. Reinforce dressing on chest tube site. Rationale: LPNs can reinforce dressings but not manipulate drainage systems. Strategy: complex equipment equals RN. Question 17. RN assigns care to UAP. Which task is appropriate? A. Monitor oxygen saturation trends. B. Perform emotional support counseling. C. Assist patient to bedside commode. D. Interpret low O2 reading. Correct answer: C. Assist patient to bedside commode. Rationale: UAP can assist with toileting/ADLs. Strategy: no evaluation or interpretation for UAP. Question 18. Which task may the RN delegate to LPN in long-term care? A. Admission assessment. B. Provide routine oral medications. C. Develop nursing diagnosis. D. Perform blood transfusion. Correct answer, B. Provide routine oral medications. Rationale, medication administration is within LPN scope except for/blood. Strategy, LPN equals routine meds. Question 19. Which is appropriate for UAP when caring for a confused patient? A. Teach safety strategies. B. Stay with patient during ambulation. C. Assess fall risk. D. Determine need for sitter. Correct answer, B. Stay with patient during ambulation. Rationale, UAP may provide standby assistance. Strategy, UAP equals supervision, not assessment. Question 20. Which patient is best assigned to LPN? A. New onset atrial fibrillation. B. Mechanical ventilator patient. C. Stable post-stroke patient needing ROM. D. Client needing advanced for titration. Correct answer, C. Stable post-stroke patient needing ROM. Rationale, stable, non-complex patients appropriate for LPN. Strategy, avoid unstable/complex LPN. Question 21. Which task can RN delegate to UAP during morning care? A. Check pedal pulses. B. Apply moisturizing lotion. C. Evaluate edema. D. Determine pain score. Correct answer, B. Apply moisturizing lotion. Rationale, basic comfort care fits the UAP role. Strategy, if it requires assessment, UAP cannot do it. Question 22. Which responsibility is appropriate for LPN in wound care? A. Stage a pressure ulcer. B. Perform sterile dressing change. C. Teach wound infection signs. D. Evaluate wound healing. Correct answer, B. Perform sterile dressing change. Rationale, LPN can perform sterile procedures but not assess or teach. Strategy, LPN equals implementation. Question 23. Which can UAP perform for a patient on a diabetic diet? A. Teach dietary restrictions. B. Determine calorie count. C. Assist with feeding. D. Evaluate nutritional intake. Correct answer, C. Assist with feeding. Rationale, feeding assistance is allowed unless aspiration risk. Strategy, routine feeding equals UAP. Question 24. Which client is appropriate for LPN? A. New GI bleed. B. Post-op unstable vitals. C. Stable hypertension follow-up. D. Client needing comprehensive teaching. Correct answer, C. Stable hypertension follow-up. Rationale, LPNs manage stable clients with predictable outcomes. Strategy, new/unstable equals RN only. Question 25. Which task can the RN delegate to UAP during busy shift? A. Collect stool sample. B. Assess stool characteristics. C. Interpret signs of GI bleeding. D. Teach stool collection procedure. Correct answer, A. Collect stool sample. Rationale, UAP can collect specimens but cannot analyze/teach. Strategy, UAP equals collection only. Question 26. Which is appropriate for LPN regarding NG tube care? A. Insert NG tube. B. Confirm placement by X-ray. C. Provide routine tube care. D. Initiate tube feeding for first time. Correct answer, C. Provide routine tube care. Rationale, LPN can perform routine care but not initial procedures/verification. Strategy, new/initial equals RN. Question 27. Which task is safe to assign to UAP? A. Administer enemas. B. Perform fingerstick glucose. C. Assess hydration status. D. Evaluate glucose trends. Correct answer, B. Perform fingerstick glucose. Rationale, UAP may perform simple procedures depending on policy. Strategy, UAP equals simple, routine skills. Question 28. Which patient can be cared for by LPN? A. Chest pain awaiting provider. B. New seizure activity. C. Stable asthma patient. D. Newly admitted patient. Correct answer, C. Stable asthma patient. Rationale, LPNs may care for stable respiratory clients with predictable conditions. Strategy, LPN avoids new admissions. Question 29. Which UAP task is appropriate? A. Encourage deep breathing. B. Assist with oral hygiene. C. Assess cough effort. D. Teach incentive spirometer. Correct answer, B. Assist with oral hygiene. Rationale, oral hygiene is routine care. Strategy, UAP equals ADLs only. Question 30. Which may the LPN do under RN supervision? A. Interpret ABGs. B. Titrate oxygen. C. Administer oral antibiotics. D. Initial respiratory assessment. Correct answer, C. Administer oral antibiotics. Rationale, LPNs give routine oral meds. Strategy, interpretation equals RN. Question 31. A client with dementia becomes incontinent during the night. Which task can the RN delegate to the UAP? A. Assess reason for incontinence. B. Teach bladder training techniques. C. Assist with changing linens and cleaning. D. Determine need for toileting schedule. Correct answer, C. Assist with changing linens and cleaning. Rationale, UAP may perform hygiene and routine care but cannot assess or teach. Strategy, delegate basic ADLs to UAP. Question 32. Which assignment is suitable for an LPN? A. New admission with pneumonia. B. Client requiring complex 4 titration. C. Stable post-op patient on oral antibiotics. D. Client needing pre-op assessment. Correct answer, C. Stable post-op patient on oral antibiotics. Rationale, LPNs handle stable patients with predictable outcomes and non-for meds. Strategy, avoid new, unstable, or complex care for LPN. Question 33. Which task should be delegated to the UAP? A. Perform passive range of motion exercises. B. Assess joint mobility. C. Provide education on contracture prevention. D. Evaluate effectiveness of ROM. Correct answer, A. Perform passive range of motion exercises. Rationale, ROM exercises are routine tasks appropriate for UAP. Strategy, no assessment or evaluation for UAP. Question 34. Which activity can the RN assign to the LPN caring for a patient with a colostomy? A. Develop teaching plan. B. Assess stoma color. C. Perform routine ostomy care. D. Evaluate skin integrity. Correct answer, C. Perform routine ostomy care. Rationale, LPN can perform skilled, routine procedures, RN handles assessment and teaching. Strategy, LPN equals implementation, not assessment. Question 35. Which task is safe to delegate to UAP caring for a hypertensive patient? A. Monitor BP response to new medication. B. Recheck elevated BP reading. C. Report changes in LOC. D. Assist the patient with a shower. Correct answer, D. Assist the patient with a shower. Rationale, ADL assistance is appropriate for UAP, monitoring responses requires RN. Strategy, UAP equals routine bathing/toileting tasks. Question 36. Which patient is appropriate to assign to an LPN? A. First day post-thyroidectomy patient. B. Unstable heart failure patient. C. Stable patient with chronic anemia. D. Client requiring initial physical assessment. Correct answer, C. Stable patient with chronic anemia. Rationale, LPNs can care for stable, predictable medical patients. Strategy, LPNs should not take unstable or newly assessed patients. Question 37. Which task can the RN delegate to UAP for a patient with fall risk? A. Perform fall risk assessment. B. Teach use of call bell. C. Stay with patient during toileting. D. Determine need for bed alarm. Correct answer, C. Stay with patient during toileting. Rationale, Supervising during toileting is within UAP scope, assessments and teaching are not. Strategy, delegate safety support, not assessments. Question 38. The LPN can safely perform which action for a client on enteral feeding? A. Insert a nasogastric tube. B. Verify NG placement before feeding. C. Administer routine enteral feeding. D. Teach aspiration precautions. Correct answer, C. Administer routine enteral feeding. Rationale, LPN can administer feedings but cannot perform initial placement or evaluation. Strategy, avoid initial assessment, teaching for LPN. Question 39. Which task may be assigned to UAP for a client on bed rest? A. Assess skin integrity. B. Turn every 2 hours. C. Apply medicated ointment. D. Teach pressure injury prevention. Correct answer, B. Turn every 2 hours. Rationale, routine repositioning is a UAP task. Strategy, routine mobility equals UAP. Question 40. Which client is best assigned to the LPN? A. Chest pain awaiting evaluation. B. Newly admitted septic client. C. Stable post-CVA client needing suctioning. D. Client with uncontrolled blood sugar. Correct answer, C. Stable post-CVA client needing suctioning. Rationale, LPN can suction stable clients, unstable or new admissions require RN. Strategy, LPN equals stable plus predictable respiratory needs. Question 41. Which task is appropriate for UAP during mealtime? A. Feed client with dysphagia on first meal. B. Assess swallowing reflex. C. Position client upright before feeding. D. Evaluate aspiration risk. Correct answer, C. Position client upright before feeding. Rationale, positioning is safe for UAP, dysphagia assessment must be RN. Strategy, assign only non-assessment tasks. Question 42. Which task can LPN perform for a client with a Foley catheter? A. Insert Foley catheter in unstable patient. B. Assess reason for oliguria. C. Collect urine specimen from catheter. D. Teach catheter care. Correct answer, C. Collect urine specimen from catheter. Rationale, LPNs can perform routine procedures but cannot assess or teach. Strategy, LPN equals predictable, routine care. Question 43. Which can be delegated to UAP caring for a patient on seizure precautions? A. Teach seizure safety. B. Suction airway during seizure. C. Place padded side rails. D. Assess seizure characteristics. Correct answer, C. Place padded side rails. Rationale, safety preparation tasks can be done by UAP. Strategy, UAP equals safety setup only. Question 44. Which patient is appropriate for assignment to the LPN? A. Client requiring initial diabetic teaching. B. Newly diagnosed acute renal failure. C. Stable client with controlled hypertension. D. Client requiring titrated insulin drip. Correct answer, C. Stable client with controlled hypertension. Rationale, LPNs take stable, chronic clients, complex 4 titration requires RN. Strategy, complex/teaching equals RN only. Question 45. Which task is appropriate for UAP during morning rounds? A. Determine pain score. B. Check dressing drainage. C. Assist with grooming. D. Evaluate mobility limitations. Correct answer, C. Assist with grooming. Rationale, grooming is a basic ADL. Strategy, UAP equals routine comfort care. Question 46. Which intervention can the LPN perform for a post-op client? A. Evaluate response to analgesics. B. Administer 4-push analgesia. C. Reinforce post-op teaching. D. Perform initial assessment. Correct answer, C. Reinforce post-op teaching. Rationale, LPNs can reinforce, not initiate, teaching. Strategy, initial teaching equals RN. Question 47. Which action can RN safely delegate to UAP in caring for a stable post-op patient? A. Monitor drain output trends. B. Empty Jackson-Pratt drain. C. Assess incision healing. D. Evaluate infection risk. Correct answer, B. Empty Jackson-Pratt drain. Rationale: UAP may empty drains but cannot assess trends or evaluate. Strategy: UAP equals simple procedural tasks. Question 48. Which client assignment is suitable for an LPN? A. Patient requiring initial blood transfusion check. B. New onset confusion and agitation. C. Stable COPD patient with scheduled inhalers. D. Client requiring comprehensive assessment. Correct answer, C. Stable COPD patient with scheduled inhalers. Rationale: LPNs may administer routine inhalers to stable patients. Strategy: avoid unstable patients for LPN. Question 49. Which task is appropriate for UAP in a surgical unit? A. Measure abdominal girth. B. Assess drainage odor. C. Teach deep breathing techniques. D. Evaluate bowel sounds. Correct answer, A. Measure abdominal girth. Rationale: simple measurements are allowed, assessment/evaluation is RN only. Strategy: UAP equals measure, not interpret. Question 50. Which intervention may be assigned to the LPN for a diabetic patient? A. Develop BG management plan. B. Teach insulin mixing techniques. C. Administer routine subcutaneous insulin. D. Evaluate response to therapy. Correct answer, C. Administer routine subcutaneous insulin. Rationale: LPNs administer routine injections but cannot evaluate or teach. Strategy: LPN equals routine medication administration. Thank you for studying with NCLEX Made Easy 91. If you found this Delegation NCLEX practice helpful, don't forget to like, comment, and subscribe for more high-yield NCLEX content delivered in the simplest and clearest way possible. Keep reviewing, keep practicing, and remember, you've got this, and your NCLEX success is within reach. See you in the next video.